Mr. Speaker, farmers love their animals and would do anything to protect them. The Canadian Food Inspection Agency is planning to cull 400 ostriches in BC because of an outbreak of avian flu. When it comes to animal safety, Canadians expect due diligence and transparency. Canadians are looking to this government to explain why the cull is necessary, but the Liberal government has not posted a public update in over a month. Canadians want to know, why did the Liberal ministers not work with the agriculture sector to resolve this issue?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I want to make sure that this member knows that I am working very closely with the Minister of Agriculture, and the case is now in front of the court, so I won't comment more. Thank you.
She's a voodoo woman, guys. Don't make jokes. Here, Canadian Looney, this one is downright embarrassing. Forget Aunt Jemima. We have a voodoo woman as our health minister. Bring in the voodoo translators for this Haitian Grecian formula. Like, she is brutal, guys, and you can see that she is arrogant in her answers. Like, the Liberals don't stick this minister in front of the cameras very often. It's obvious why. Let's take a peek. Dan Mazier has some questions. He's the health critic for the Conservatives. And this lady is arrogant and obnoxious. Don't let her fool you. Don't be conned. Don't be afraid to say, like, what is on your mind. This woman is trash. Let's take a peek.
Oh, yeah.
Okay, we'll start with a round of questioning for me for 6 minutes. So, Minister, Health Canada approves supervised consumption sites across Canada. Do you personally review the applications before they're approved by the department? Yes or no?
Les sites de consommation supervisée.
So the supervised drug consumption sites have got an exemption from Health Canada. In fact, it's the provinces and territories that fund those programs.
Personally review the applications
Les applications qui sont
yes or no?
Les applications
the applications that come into the department are reviewed individually each time, depending on the consultations with provinces and territories, organisations on the spot, and also public security.
Here too, so I'll ask the question again. Do you personally review the applications before they're approved by the department? Yes or no? Just oui or no?
Les applications sont revues par le département.
The applications are reviewed by the department.
So you've never seen them?
Je viens de vous dire que les applications sont
I have just said that the applications are reviewed by the department. There's a process that is in place and they are reviewed individually by the department.
Okay, so you do not personally review those applications. Minister, are you aware that fentanyl is the most used drug in supervised consumption sites that your department approves? Yes or no?
Selon les chiffres que nous avons vus,
according to the figures that we've seen, which are published, we've seen that fentanyl is one of the drugs that's the most used in these consumption sites.
How much fentanyl is consumed in the federally supervised consumption sites?
Vous savez, dans les centres de consommation,
in these centres, people use illegal drugs, but these consumption sites have been created, first of all, to save lives. There's 68,000. We've been able to prevent 68,000 deaths.
Approved supervised consumption sites. Do you know?
Je pense qu'il y a du fentanyl, certainement, c'est le plus.
Fentanyl, well, it is the highest consumption, but there are certainly other drugs that are consumed there as well.
Non, des exemptions. Les provinces et les territoires.
The federal government gives options, but it's the provinces and territories that actually run these sites.
How much fentanyl is used in these sites?
Je vais me retourner vers.
I'll return to my officials.
The sites are operated by...
I'm not asking if they're operated. I want to know how much fentanyl is used by these sites. How much is the federal government supplying fentanyl into these sites?
Je vais dire à mon collègue, de toute façon, trop.
I would say as an answer, too much.
That your department is approving supervised consumption sites next to daycares, schools, and playgrounds.
Vous savez, les sites de consommation,
The consumption sites, as I've said, they were created to prevent deaths because of overdoses. We examine all of the applications with criteria that include the provinces, the territories, community organisations, and also the public safety services in each province. And it's the provinces and the territories that administer these, and they have their rules.
That the department is approving supervised consumption sites next to daycares, schools, and playgrounds. Are you aware? That's all the question was. Yes or no?
ben, je lis les articles comme vous
I read articles like you that have said that some of these sites are close to schools, and the provinces and territories implement rules. They're the ones who administer these consumption sites. So they set rules according to their criteria and their issues on the ground.
How many supervised consumption sites approved by your department are next to daycares?
Je pense qu'au total, nous en avons 33 qui sont actuellement.
I think there's 33 that are currently underway, but I can't say exactly how many are close to schools.
That was next to daycare. How many are next to schools?
Je pense qu'il y a 33 au total, mais
There's 33 in total, but in reality, when we grant these exemptions, we only grant them after the analysis and in light of our criteria and after consultation, as I've already said, with the provinces and public safety as well as community organisations.
So, but you are aware that they're next to playgrounds and schools and daycares, but you don't know how many.
Ben, écoutez,
Can
je
you
le vois,
table
oui,
that
je ne peux pas vous le
information?
dire non parce que je vois
I
des articles.
cannot say that. I see articles in newspapers as well, but that does not directly fall under my authority.
Be tabled to the committee?
We can share information about the community consultations that are considered as part of the approval of supervised consumption sites.
Minister, can you commit today that your department will no longer approve supervised consumption sites next to daycares or schools? Yes or no?
Monsieur Mézier, je viens de vous. Oh, pardon.
Mr. Mazier?
It's going to be 6 minutes. It's over.
She has 5 seconds to answer yes or no.
Est-ce que vous pouvez répéter votre question?
Could you please repeat your question?
Commit today that your department will no longer approve supervised consumption sites next to daycares or schools. Yes
Je vais
or no?
confirmer que mon département va continuer à
I
travailler.
can confirm that my department will continue to work to protect the health of Canadians.
Thank you, Minister.
5 million Canadians signed up for this program, but only about half have actually gone to see an oral health care provider. How do you explain that discrepancy, especially when some of those people would have been able to apply half a year ago?
Well, you know, I think two things. It's still a new program. The fact that people are enrolling to the program and the fact that we have more than 5 million people accepted by the program, it's a good news. Now the program is available for them. It's like, you know, you can go to your doctor and you don't feel the need to go tomorrow morning, but you still can go to the doctor. It's just the same. This is how I see it. So people have their little card in their hands and they will reach out to their dentist when they need. So I feel to have people enrolled in the program is key for them to have the opportunity to go.
Many patients that I've spoken to say that a concern they have with the program is the balance billing part. So that basically allows a dental clinic to charge more than what the federal government will reimburse them for. Sometimes it's more than what the provincial fee guide is as well. So I'm curious if you would consider putting any sort of restrictions or limits on what dentists or oral health care providers can charge people for these services. I think previously a lot of people thought this was free health care, but there are still a lot of people who say they are really surprised when they see the bill, and it's a lot more than what the federal government is reimbursing the dentists for. So would you consider putting any sort of limits or restrictions on dentists and oral health care providers?
Okay. So let me be clear. It's a new program. It's a program we built as
well, it's a year and a half old. It's a year and a half old at this point.
Yes, but it's still new. You know, it's a new service that we are providing to Canadians, and we are working with a company to making sure that we are providing the services. We are monitoring very closely how, you know, fees are applied to patients, and my department is working closely also with the providers, to make sure that we can understand the cost, why the costs are applied, and we will improve within the time. If I'm considering putting some, you know, restriction, I wouldn't say this for today, but it's still a work in progress.
As a European, I am a European actually.
Oh, you are?
Yeah,
Oh,
I'm an Irish citizen. Yeah, so there you
welcome.
go.
Welcome.
Speaking as a European.
WTF.
Here, here. How many kids did you molest with Jeffrey Epstein? More than just elbows.
And as the most European of the non-European countries.
Being aware of what potential conflicts of interest you sought
What
to
possible
avoid.
conflict would you have, Stephanie? Stephanie, I'm complying with the rules. I'm complying with the rules in advance. Come on, Fiona.
These are Muslim values. These are Canadian values.
Hi, everyone. Congratulations, you're spending more money on taxes than on food, clothing, and shelter combined.
Hey, that's something everyone can enjoy.
All right, gang, thank you all very much for watching. Aaron, Canadian Looney, like, share, subscribe. Smash that subscribe. We're trying to grow this thing. Canadian Federal Politics. Get yours right here. Thanks for watching. We'll catch you in the next video.